All right. Well, again, thank you everybody for joining us today for our webinar. Just a little kind of brief intro to Drs. Robert and Lori Byron, our guest speakers today for our presentation. Dr. Robert Byron is an internist who works at the Bighorn Valley Health Center in Hardin, Montana, a federally qualified health center which he helped start. Prior to that, he worked for over 2 decades on the Crow Indian Reservation. He was appointed to the Montana Board of Environmental Review by the governor from 2015 to 2017. A former governor of the Montana chapter of the American College of Physicians, Dr. Byron has been a strong advocate for addressing climate change, particularly as it relates to the public health and environmental justice aspects. And Dr. Lori Byron is a pediatrician in Hardin, in Montana as well. She worked for over 25 years on the Crow Indian Reservation and is now a pediatric hospitalist at St. Vincent's Healthcare. She is a former president of the Montana chapter of the American Academy of Pediatrics and currently serves on the Children's Health Advisory Committee to the EPA and the Executive Council of the Committee on Environmental Health at the American Academy of Pediatrics. She recently earned a master's degree in energy policy. Along with Robert, her husband, she is a co-chair of the Citizens Climate Hobby Health team and helps start Montana health professionals for a healthy climate. So with that, I'd like to give a warm welcome to both Drs. Lori and Robert Byron, and the floor is yours.
Thank you, Alona, and thanks for the opportunity to be here, and thanks for everybody for joining. Before we get started, since our topic is climate change, health impacts, but more importantly, healthy solutions, would just like to ask folks if they're willing to or have an idea to put in the chat box impacts that climate change either is having or may have on you or people you work with in your area, just to get an idea. It's not a test. Okay, without a lot of participation, we'll push on. Okay. Oh, okay, perfect.
Now, yep.
There we go. Now we can see them.
There you go.
Yeah. All right, and love seeing the emphasis on food. That's outstanding. So a couple, I guess, housekeeping things. One, our presentation will be available to be shared. It'll be posted after we're done today. We also feel free to put questions in the chat box that we'll look at as we go through and after we get done with the presentation itself. And lastly is we welcome questions. If you come up with some later, our contact information's there and we'd love to hear from folks. So with that, let's push on. Here we go. Okay. As we're talking about climate, which we'll be going through today, is want everybody to keep in mind to think silver buckshot, not silver bullets. When it comes to climate change, like so many other issues, there is no one answer. Also, it is no single person's, state, nation, organization responsibility. This is very much a group participation project. Ultimately, climate change is going to affect every single person on Earth, but now it's affecting some a lot more than others, particularly children, the elderly, pregnant women, the poor, indigenous populations. Women in general are more affected. The disabled, agricultural and outdoor workers, and rural populations. And certainly for those of us in the West, many of us fit into more than one of these populations already. So this is the single slide that we will have on climate change itself. And this pretty much sums it up. Keeping in mind that climate change is the result of greenhouse gas emissions from humans. That results in increased pressures, or I'm sorry, increased temperatures, extreme weather, extremes of precipitation. And while it's not impacting us, rising sea levels are impacting millions in the US alone and countless millions worldwide. Kind of the next level down on this shows some of the exposure pathways, as they're termed. We will see extreme heat waves. We'll see more air pollution, and I'll come back to that. Water contamination from floods, overrunning sewers, and more agricultural runoff. Changes in vector ecology like mosquitoes, ticks, and increased allergens, which is particularly important not just for those people with hay fever, but for people with asthma and increased asthma. And as many already commented on, problems with the food supply, and also population displacement, which is going to be huge worldwide. And as we move on down on this slide, ways it will impact individuals: heat stress and heat stroke, respiratory and cardiovascular disease, vector-borne diseases. Mental health is huge. Impacts on fetuses and pregnant women is huge. And then in addition, physical trauma from increased strength of storms, wildfires, and others. Going back to air pollution, as I mentioned, air pollution will worsen with climate change, but air pollution, and particularly greenhouse gases, is also the primary cause of anthropogenic climate change. And it's important to keep in mind that now in the United States, there are anywhere from 60 to 135 or 140,000 premature deaths every year due to air pollution. Almost half of those are from increased numbers of heart attacks and strokes, but other impacts, up to 150,000 hospitalizations, 18 million lost work days, and then also increased amounts of lung cancer, fetal harms, links to learning behavior disabilities in children, increased diabetes, and increased dementia. Again, keep in mind, this is now. This is not just, or not climate change, this is air pollution. That's going to get worse. Globally, each year, air pollution kills between 8 and 9 million people. About half of that is from outdoor air pollution, which is mostly what we see in the US, but the other half is indoor air pollution, predominantly from burning fossil fuels and cooking inside. It's worth mentioning that those of us with wood stoves or that burn gas also have more indoor air pollution. That's a little frustrating sometimes, but it's also important to note that we can make a difference. And a good example of that was in 2011, I-405 in Los Angeles was going to be shut down for a day for repairs. When they shut it down, there was about a 60% drop in traffic in the area. And then within minutes, the air quality for hundreds of miles around improved. What they saw during that time was particulates were down about 83%. Emergency room visits at UCLA, which is in the area, was down 23%. And emergency room visits at Mount Sinai were down 13%. Even 911 calls decreased. The same thing happened in Atlanta in 1996 during the Summer Olympics, with about a 20% reduction in traffic because of restrictions at the time. There was a 40% reduction in pediatric visits to the emergency room for asthma during that time. We've also seen some similar effects recently with the shutdown of so many economies because of COVID. Now, it's not to take advantage of that, but we've seen clearing of the air that hasn't happened in decades. Now, it will be hard to sort out how much impact that has on health because of the impacts of COVID itself. And I also want to point out that that's great. It clears the air. It has improved air quality, but that will have no appreciable effect on climate change itself. And why is air quality such a problem? Primarily because of the impacts of ozone and particulate matter. And when ozone here, we're talking about ground level ozone, not the ozone holes that we hear about from NASA and others. Those are high-level ozone. Ground-level ozone is formed because of the impacts of sunlight or ultraviolet light on air pollution, primarily nitrous oxides and VOCs. The other thing is particulate matter, just to keep people informed. I used to think of this as dust or other things in the air that were pretty inert. And I was very wrong. Particulate matter is dust and other things, smoke particles from fires, but also it's acids, it's heavy metals, a variety of others, and these are very biologically active components. PM 2.5 are those particulate matter under 2.5 microns, and keep in mind that 2.5 microns is about half the size of a human red blood cell. Those set up systemic inflammation, resulting in more vascular disease and heart attacks. They have negative impacts on fetal and maternal health. And in fact, these particulate matter has been found on the fetal side of the placenta. Think about that. There's no way in the world that we ought to be seeing air pollution on the fetal side of the placenta. That gives you some idea of how much impact these have. Also, pulmonary inflammation, setting up lung diseases and others. Moving on to the direct impacts of climate change itself. Heat is one of the most profound, particularly in the US, results in both heat exhaustion, a heat stroke, and dehydration. And then indirectly, because of heat alone, and this is in addition to the heart attacks from air pollution, we see more heart attacks, strokes, suicides, lung disease. People think less well, and perhaps even increased amounts of diabetes, as well as complications from diabetes. Other indirect effects include things like spread of diseases, vector-borne diseases, as ticks and mosquitoes can spread over a much wider disease. Additionally, in the case of mosquitoes, they bite more often as it gets warmer. They mature faster, and also the diseases within them mature faster. And in fact, in the United States, diseases from mosquitoes, ticks, and fleas have tripled since 2000. So in less than 15 years, because that's when the study was done, that number has tripled. We see increased allergens due to longer season and enhanced growth. We see increased algal growth with harmful algal blooms with water contamination. That happens both in the oceans and in freshwater. And then we also see drought with agricultural losses, stress, and increased fungal diseases. And this is just one example of the kind of things we expect to see. A study showed that in 2000, the grains of pollen per cubic meter in one area were about 8,400. By 2040, that's going to be almost 3 times that amount. So just to emphasize, going back to air quality and the impacts, that the air quality itself worsens with climate change, lingers more in stagnant air, we'll have more wildfires with more particulate matter. Ozone is worse as it gets warmer. Allergens increase, and already about 10% of people in the US have either asthma or chronic lung disease. And then heat and air pollutants will increase and result in more ER visits. Just a couple of examples. This goes back to the number of disease cases in the United States as a result of ticks, fleas, and mosquitoes. It starts in 2004 with about 27,000, and in 2016 it was almost 100,000. And this just shows this, not the spread of disease, but the areas that 2 species of mosquitoes populate in the United States. The one on the left, Aedes aegypti, and the one on the right, Aedes albopictus, which is the tiger mosquito. Both of these can transmit dengue, yellow fever, and Zika. Now, we haven't seen much of that in the United States, but certainly now, as these mosquitoes spread, the potential is there. Looking at foodborne and waterborne diseases, increased flooding results in contamination from overwhelming sewage treatment plants and agricultural runoff. And in fact, in the United States, most waterborne outbreaks are associated with excess precipitation events, which is going to increase with climate change. Worldwide, diarrhea is the #2 cause of death in children under 5, with about 1.6 million deaths per year. And consider that a 1 degree Celsius increase in temperature increases diarrheal diseases between 5 and 16%. So that is a dramatic number. And with that, I'm going to turn it over to Lori.
Hi, and thanks for being here. If you go back to your chat again, would you just list in there what your job training is and what you actually do? Like you might be a nurse that does QI or something. Just kind of pop that in there so we can see who we're talking to. See in a virtual way. It'll take just a second there. Yeah, great. Thank you. It's really great to be a pediatrician. I've got to spend most of my life caring for babies and their grown-ups. And what Rob and I did for almost 3 decades on the Crow Reservation is what many of you still do now, directly or indirectly, which is to look at ways to prevent premature death and improve health. And that's what led us to work on climate. So children and fetuses and pregnant women are all more vulnerable. And let's look at a couple ways that you might not have heard of before. So one is that our fertility is decreased when we are exposed to air pollution. There's been several studies on traffic air pollution, and then there's been studies done around fossil fuel power plants that have then been decommissioned. And they found that we've had significant improvements in fertility after they were decommissioned. We also have problems with our fetuses when we are exposed to increased temperature during our pregnancy. So besides making us feel awful, it doesn't do good things to our fetuses inside. So the babies are actually more likely to be born premature, or be born too small, intrauterine growth retardation, or be born stillborn, or have certain kinds of birth defects. So our fetuses are actually exquisitely sensitive to the particulate matter that their mother breathes. So whether that particulate matter is from dust or forest fires or coal-fired power plants or exhaust from our cars or from smoking, it's a bad thing for the fetus. And it's actually estimated that about 25,000 of our premature births, about 3% of premature births, are because of air pollution in the United States. So again, small babies, premature babies, and sudden unexplained infant deaths are all increased when a mother's been exposed to air pollution. There's also links between air pollution and adverse neurodevelopmental issues. Now, remember, there's a lot of other things that cause these neurodevelopmental issues, but there's been about 30 different studies looking at various kinds of air pollution and various ones of these issues, and definitely seems to be a link. It's something that does need more research. One of the compounds that's released when we burn fossil fuels is polycyclic aromatic hydrocarbons, or PAHs. And when women breathe those in, their fetus, after it's born, is actually more likely to be obese as a child. There's also links to blood pressure, and when women are exposed to air pollution when they're pregnant, the fetuses that become children are actually more likely to have elevated blood pressure. And note that all of these kind of risks are going to go away as we clean up the air. So malnutrition is something of great concern to pediatricians, and obviously to some of you based on some of your responses. And good nutrition is so vital for us to reach our mental and physical potentials in life. And it's a huge problem in the world. About half of the children that die every year die from hunger. And even in the United States, food insecurity is a big issue, with 14% of Americans food insecure. And some of you all probably know even better than I, but food security has actually been researched, and it's well documented that it actually creates lifelong health and mental health issues. For example, children who were food insecure are actually more likely to be obese or have diabetes as adults. So there's a number of ways that climate change threatens our food supply and our nutrition. One of those is because of the CO2 in the air. So when there's increased carbon dioxide, plants grow better. That's what we all learned back in basic biology. But what they actually do is they produce carbohydrates better. And so the plants contain more carbohydrates. And then that means they contain less protein, and they also contain less micronutrients. So this is a significant problem, for example, in places where there's hunger and starvation, because when you have less protein, you develop a more severe form of starvation and malnutrition. About a fourth of the people in the world are deficient on zinc and iron already. So having less micronutrients in our grains, which is our primary source of caloric intake, is significant. And of course, heat affects our crops. We tend to think that plants like heat, but they only like the right amount of heat. So for example, in America, the central part of America where we grow all our grains, days that are above the early 80s, for every day that's above the low 80s in temperature, there's actually a decreased yield for the year. So as things get hotter, the yields are going to fall unless we develop new agricultural strains, of course. And extreme weather events like severe winds and floods and hail events, of course, can damage our crops. And of course, drought can, which we saw in a big way back in 2017 with the worst drought on record in eastern Montana, and a huge decrease in the crop yields that year. And then the pestilences, the bugs and the rusts and the fungi that attack our plants, they're all undergoing what's called a poleward migration. They're moving farther north and farther south, so they're covering a larger band of the earth. And like Rob said, this, just like other insects, they're eating more, they're laying more eggs, they're doing more damage, they have a longer season to thrive in. So it's a problem. And then we have the oceans, which doesn't seem like much of a problem for us, but for a good percentage of the world, their primary source of food is from the ocean. And since the ocean has absorbed most of the heat in the atmosphere, it's led to conditions that aren't optimal for coral reefs. So for that and other reasons, we've lost half of our coral reefs in the last 30 years. And besides the fact that they're beautiful, they're important because about a fourth of the fish species in the ocean start out living in the coral reefs because it's a safe place to grow. And then because the oceans have become more acidic by absorbing the CO2 in the atmosphere, it's affecting our shelled animals. So a lot of the zooplankton are shelled, and they can't lay down their shell if the water is of a certain acidity while they're small. And even up into the larger animals like lobsters and things that we eat, anything that has a shell can be affected by the acidification. But I find that some of the greatest hope is in agriculture. So just a few examples. There's a lot of community supported agriculture, and this helps lower the carbon footprint of our food by being local. There's a lot of farmers markets. There's about 100,000 now in the United States. When we get out and we support farmers markets, we actually see our food, we see the people that made the food, we tend to make healthier food choices. We tend to be more connected to our community, which helps our mental and our physical health. People are also demanding to eat healthier food. So about 6% of our food is now organic in America, which is, it's actually growing by leaps and bounds. And that tends to be, again, more sustainably grown, so better for the land and allowing the land to absorb carbon, which is a good thing. And then we always have a little bit of an out because most of us have backyards. And we saw back in World War II when all the food and the fruits and vegetables were being sent overseas, people had to grow their own gardens again. And they did so in a big way, and they actually produced half of the fruits and vegetables that they ate. So we do have some leeway there. But there's some fantastic things going on in Indian country, which a lot of you probably know about far better than I, but let me just bring up a few of them. The Blackfeet have started a beaver mimicry project where they basically put dams in the small creeks like beavers would do, and it actually allows the groundwater to recharge in areas where the groundwater has been lowering. The Zuni Indians had the same thing going on, except they didn't have beavers, so they actually just put big brush piles in their arroyos, and then when they had a flood, the banks would flood and it would flood their fields and allow them to grow crops. Otherwise they couldn't grow crops. We have a lot of tribes that are really emphasizing having the elders teach the younger generation about subsistence foods and ceremonial and medicinal plants. all of which are a good thing. The Blackfeet are looking at reintroducing buffalo. They've actually found that they can be kinder on the environment, despite what we hear sometimes, and they're also tougher, so they can withstand the extreme heat, and they can withstand the extreme weather events better than cattle can. And then we have a lot of people looking towards sustainable agriculture. Again, the Blackfeet are a great example because they're hoping to get away from the monoculture that we tend to have, our traditional farmers are doing nowadays. And then of course, Fort Belknap has the food bank that is the model for the whole state of Montana. So there's a lot of great things going on. Extreme weather events affect our health and our life. And because we lose people every year, deaths from extreme weather. And we also have this whole new group of people called climate refugees. And even in Americans, we have US citizens being climate refugees because they've had severe enough events that they've lost their homes. And we all know what lack of a secure home does to our health and our well-being. Rob and I got a small taste of that in Bighorn County when we were still working at Crow in 2011 with a flooding we had then. And from the outside, if you had driven down the interstate 2 weeks later, you would have said, oh, it's all over, no big deal. But for those of us living here, we saw that it was a big deal because there were a lot of people that, just like everywhere all the time, they were just living on the edge. They had just enough money to get by. And if they lost their drywall or their clothes or their furniture or their whole entire house, they just couldn't get back on their feet. And what we found is that years later, there were still people that were homeless or living in crowded situations, more crowded than before, or living in a FEMA trailer. And we know, again, we know what that does to your health. But we know that with the social determinants of health, that housing is one of the most important things to have. So a real story that's not told all that often with climate change is displacement. And I can't even begin to address or comment on how significant displacement is for place-based people, the historical trauma of having a reforced relocation. But we have a dozen Alaskan villages that look like this picture and another 18 that are close to this picture that need to be relocated. The same thing is happening in the Gulf of Mexico with the tribes in tribal lands in southern Louisiana, and also off the coast of Maine on tribal lands. We're having these relocation issues because the land's being eroded away. So we also have mental health issues. There's actually a whole new word in the last few years called solastalgia, and it's the angst that we all can feel when we feel like we're losing our home and yet we're still in our home. But there's a lot of other mental health problems with climate change. We know that heat causes an increase in all forms of violent behavior, including child abuse and spouse abuse and murders and suicides, and also alcohol and substance abuse. And we know there's a lot of mental health issues after severe weather events, and that these issues can last for years, like PTSD. It looks like it's probably worse in children also. And then the group of people that are taking some psychotropic medications become another vulnerable population because it affects their ability to withstand heat. So there are a lot of issues, but Rob and I tend to think that there's a lot of hope. We do think the problem's bigger than changing light bulbs because our personal actions are just not enough in this situation, although changing your light bulbs is a good thing. So let me try one more thing in the chat here. And just think of the course of a typical year, not a COVID year, and think about what's the main charitable or social justice or community sort of action that you spend the most time at. It might be volunteering at the food bank or your church, or voter registration, working with 4-H with your kids, anything like that. Just what's the thing that you do more than anything else? Oh, it doesn't have to be climate related, sorry. Although you guys are all coming up with things, which is awesome. That's great. So one of the most important things is to do something. So climate change, like a lot of other problems in our world, it can be a scary topic. And it's so scary that as a defense mechanism, sometimes we choose to ignore those scary topics, but it's actually been researched and shown that when we do something, we feel better, even when we lose. We feel like we lose. So when we do voter registration, we feel better even if our candidate doesn't win. And the same thing with climate. So getting connected is really important, and it sounds like a lot of you already are. I mean, there's 5 tribes in Montana that are working on climate change, the Chippewa Cree, the people in Fort Belknap, Northern Cheyenne, Blackfeet, and SKC. There's also climate groups in almost every city in Montana, which is great. For example, one project in Missoula is looking at urban trees, and urban trees are actually great for our health. There's been good studies shown that people with similar socioeconomic status living in an area of the city that has trees versus doesn't have trees, they're actually more likely to walk. They're significantly less likely to be obese or have diabetes. So the trees have great health effects, but they also have great climate effects because they're capturing CO2, they're capturing air pollution, they're helping with water runoff, and they're lessening the heat island effect that we tend to see in concrete laid areas. And reasonable housing, of course, you all, again, know better than I how important it is for good health to have reasonable housing. And there's Native American projects going on, like the Red Feather Organization in Bozeman, but there's also projects, again, in Missoula and other places looking at just weatherizing and improving homes, which actually improves our health and our mental health, as well as lowering greenhouse gas emissions. And then for a lot of us, we get inspired by our kids when they come home and tell us stuff from school, back when we did school. So this gal actually raised enough money to put solar panels on her school in Bozeman, which is pretty cool. There was this group of teenagers and young adults in the Blackfeet. And again, those of you that are Blackfeet or living near there can tell us more about the projects afterwards. But they started this great program a few years ago, and a lot of these young adults have now gone on to do other things related to environment and climate, which is really cool. So I know all of you on the call are super busy, overworked people. So the last 3 suggestions are things that take 0 time, but are really important. And one of them is just to talk about climate. Climate has become so politicized that we're scared to talk about it, even though about 2/3 of Americans think that climate is very important or fairly important. So there's actually not that many of those climate deniers out there as we think. So just talking is important. Another thing is just voting. And I say it's time commitment 0 because it should just be something that we all do because we have the privilege to do it. And then the third thing you can do is you can join up with us, with the Montana Health Professionals for Healthy Climate. Just sign up for our newsletter. We hope to be lobbying in the legislative session next year in promoting renewable energy and having more numbers of healthcare providers that care about this issue behind us. I think will give us more power as we lobby. So we're done with the formal presentation, and I would love to hear now from some of you, some of the stuff that you've already been putting in the chat. Alana, can the people talk or?
Yep, so if you are on only by phone, you can press *6 to unmute and then mute yourself. And then for those of you who are joined by the computer, they're little, I think most people are pretty familiar with Zoom, but the control bar has a couple buttons down below, and that's where you will unmute yourself if you want to speak. I actually had a question. I had read where I need to start putting all of these resources that I find in a better spot so I can access them a little quicker. But I read that trees actually have, whether it's a chemical or a compound or something, that when you're in nature, it actually emits, and it helps to improve our mental health, how it reacts with our bodies. Is that true? Have you guys heard that before?
Alona, the answer is we don't know. But we'll certainly try to find out and get an answer for you all. I mean, clearly they make a difference in mental health and general health. Whether that's, but I have not seen that anybody has put a reason on that, whether it's a chemical they emit or what, but that's a great question. We'll try and get an answer and get back to you.
Thank you.
And one thing I'd like to point out, and that is, you know, a lot of the things both here and that you see related to climate, is just one step in the process. For example, Lori mentioned weatherization. If we were to improve the energy efficiency of homes and even more so buildings in the United States, that would go a long way towards affecting climate change, but you don't hear a lot about it. But that involves everything from both helping people weatherize a home, but also to having policies in place so that new homes and new buildings that are built are more energy efficient as they can be now compared to 20 or 30 or 40 years ago. But it also means having programs in place so that people can afford to do that. And when we do things like weatherize homes appropriately, people's health improves because the air quality can improve. They spend less money on energy and they have to burn less energy in the home, thus another thing that adds to air quality improvement. And that's one example. Another example is most people involved in climate change think we need to transition away from fossil fuels over time completely. But that also means those people whose income or whose livelihood is based on fossil fuels need to have another way to make a viable income. That's part of the discussion that needs to occur. It's not just, oh, let's shut down all the mines and all the coal-fired power plants and all the oil plants. It needs to be a discussion of, okay, let's make sure people have jobs, because if you don't have a job, health takes a second fiddle to that. So.
Michael, I'd love to hear from you. Rob and I went up and visited Blackfeet a year ago and sat in on a day-long agricultural resource management plan meeting, and we were just blown away with the fantastic ideas and the things that people are doing there. And you guys were the first group of any variety in Montana to have any kind of a climate plan. It's just fantastic.
Maynette, is Michael able to unmute himself?
I'm not sure, but what I'll do is I'll promote him to a panelist so that he can.
Perfect, thank you. So once Michael gets promoted to a panelist, then he'll be able to unmute himself. I appreciate that fact that you just mentioned, that we want to have that, there's the other side of the coin with, once you take away fossil fuel jobs, those people now are in a position where they need to rethink how they're going to have an income. So, and I think, Michael, you should be good to talk. Just have to unmute yourself.
All right. Yeah. Hey, everyone. How's it going? Yeah. So there's a lot of really great things happening in Blackfeet country. As far as climate is concerned and the work that we're doing with the agriculture resource management plan, is we've got some programs rolling right now to increase the amount of participation of ranchers and farmers and whatnot in regenerative agriculture. So yeah, we're trying to push for grazing plans that actually build carbon content back into the soil, and in doing so we'll sequester carbon. And when you can prove how much carbon you are sequestering, you can enter onto the carbon trading market and whatnot. And through those two different processes together, you end up increasing the bottom line of farmers and ranchers, and also conserving the soils and resources that we have and rebuilding them. So that's the biggest thing that comes to mind right now in Blackfeet country. we've got rolling.
Thanks for sharing, Michael. The other thing, you make a good point, and that is, say in relation to regenerative agriculture, most of the things that will affect or improve climate change are things that either help in other ways. They actually, most of them are economically good things. So we can have these same discussions and never mention climate change whatsoever. And that's, that, as Lori mentioned, climate change itself is very politicized. But if we talk about improving health or improving economy, then we can talk about the same things and it helps climate change. A different example on that, Project Drawdown has looked at the top 100 ways and to affect climate change. And they have very good support of studies to each one. And a lot of those, there's no mention of climate change. I think number 5 or number 6, somewhere in there, is globally is providing education, especially for females, which is something that in other parts of the world is not provided. Things along those lines. I think number 1, I haven't looked recently, but was preventing waste of refrigerants, like which will have a huge impact because we let so much leak out, and a variety of others. But anything we can do to improve people's health probably is going to help with climate change as well.
I had the opportunity to hear Winona LaDuke, I think it was last fall in Billings. They had a food sovereignty event in Billings, and she was talking about, this was occurring in Minnesota, but in some of the tribal housing units, installing solar panels as a means of providing energy source for those houses. And I think that is just so, I know it's kind of like a aha, but almost like, oh, why didn't I think of that? That's so smart. Even within, other, just other communities, I don't know. I honestly don't know what it takes to install solar panels, if it's hard or if it's cost prohibitive. I'm not familiar with that at all, but I think it's very smart.
Well, there are a ton of programs. It depends on what state you're in as to how friendly they are, which, as you can imagine, isn't happening quite yet in Montana. But there still are some projects, and there are nonprofits that are doing that for people that can't afford to do so also. There's a great program in Missoula where Climate Smart Missoula went in with the health department, and they got a Robert Wood Johnson grant to look at their low-income housing and the things they can do to weatherize, improve efficiency, or go to solar or other forms of energy, because they, again, aligning those two fields, because not only does it help the environment, but it helps the human health of the people that live there. So
yeah, that's a great thing. I think about the work that we do with trauma-informed care, and then I always kind of relate moving up with Maslow's hierarchy, and when you create like a safety, and it's just home and trust and things like that, the very basic things that everybody needs. It's hard to feel like you have control or feel like you can make a change or do anything when you don't have a home or you don't have somewhere safe to be, to start that. So I know, and also being able to have an income. So, thinking creatively, and I, it's kind of a, overused phrase, but think outside the box in terms of how can we, as a community, as a state, as a region, work together to create healthier homes and just healthier communities. And I think there's quite a bit of work going on throughout Montana and among other states as well. I know Caitlin and I are a part of, Caitlin, remind me what it's called, Healthy Communities. It's put on through, is it Montana Healthcare or Montana Hospital Association?
Yes, I believe so. Yep, healthy communities. Montana Healthy Communities, a virtual journey. It's bridging the gap between economic vitality and health.
Yeah, and those are free webinars too for anybody who's interested in those. And I think we can definitely put a link in chat if you have that up, Kaylin. I don't know if you have ability to do that, but.
Yep, I'll look for that and pull it up, and I will place that in chat. It's a great series. It just got started last week, and there's actually another one tomorrow, and it's ongoing moving forward, but a great opportunity to work with others throughout the region as well.
As far as when you mentioned Maslow's hierarchy of needs and whatnot, this is Michael from the BLACKFEET Agriculture Resource Management Plan. I just kind of wanted to underscore another kind of puzzle piece to the regenerative grazing program that we have going, where, like how I already said it, it's tailored to raise the bottom line of farmers and ranchers by entering them onto the carbon trading market, while also providing them an incentive to rebuild the soil and the ecosystems of their pasture land. But then there's also the cultural element that really underpins all of the programs and work that we do, in making sure that in the end of the day, it's informed by Blackfeet ways of being and knowing, and in regards to, like many other Plains Indians, the buffalo are a huge part of the culture and identity of Blackfeet. And so they are hard to ranch for sure compared to cattle. And there's, other infrastructure needs and considerations to put in place. But, we're encouraging ranchers to go ahead and supporting them in the extra infrastructure required to, raise buffalo instead of cattle, as a way to continue to pull back into traditional Blackfeet culture, as things continue to grow and change in our contemporary world. So, yeah, it's kind of the trifecta there of conserving ecosystems, maintaining economics and building up the community, but then also feeding it in this cyclical sort of nature back into making sure that in the end of the day, we're building culture too.
I very much appreciate that, Michael.
There's actually a bill in Congress right now looking at carbon farming, basically rewarding people for putting carbon back into the soil. I think it's in the House at this point. So all these local actions are fantastic, but we do need leaders that promote this stuff too, which is why we feel like voting and contacting our legislators on things really does matter. And in fact, Rob and I were told something one time by one of our liberal Congress people who said, I guess I always thought when I sent letters that I should send it to the people that I didn't think would vote the way I wanted to do. But he said, it's actually really important for him to hear from us too, because it backs up when he makes a vote that other people complain about. So even when legislators and Congress people are aligned with your beliefs, send them a letter and ask them to vote for certain bills also, or an email or a phone call. So.
Very good. Wonderful. This has been such a impactful webinar, and I know I had the opportunity to listen to Drs. Lori and Robert Byron, Lori and Byron Robert, probably about 2 months ago, maybe a month ago. It was a colleague of mine from Mountain Pacific we were on, and we were chatting back and forth on how much this is like just wow, and you don't think about it. And I did, when you said some of the things that you can do that don't take much time is to start the conversations and include how climate change affects our physical and mental health in your work, and using that as one of the key components when you're thinking about how to intervene or how to make change on whatever work you're doing. And so I appreciate everybody joining. And anybody else have any questions, comments? Like I said, I put that in chat. If you did want to speak up, just let me know in the chat box and we can promote you to a panelist so you can speak.
And Lona, this is Rob. For anybody else out there too, both Lori and I and other members of Montana HPHC are happy to talk with any group from one or larger. There's no charge or anything, but we're happy to do whatever we can, give presentations or anything. So please feel free to contact us. The other thing about Montana Health Professionals for Healthy Climate, one, there's no charge, there's no cost to it. And also that health professionals in our minds is anybody who touches health. And we have members that are veterinarians, we have climate scientists that don't do any direct patient care or anything, but they very much are important to health. We have academicians and we have lots of public health workers. So the big thing is an interest or touch health and to try to increase the voice of health professionals in Montana in these areas. So please feel free to reach out to us or to join or to the Montana HPHC. We'd love to hear from you.
Thank you both for excellent presentation and excellent information with all of our participants. We're very appreciative of your time.
Thank you very much, and thanks for the opportunity.
Yes, thank you. You all have a great day.
Yeah, thanks for highlighting the work that we're doing up here and inviting me to speak. That was, I'm very appreciative.
Yes, and thank you for sharing. It's awesome to hear all the great work.